join me in welcoming Dr. My Le Trinh.
Good afternoon, everyone. My name is My Le Trinh. I've been a medical doctor for nearly 30 years. In all that time, I've never had a single complaint. Until one day in September 2021, when 2 complaints were made against me, just hours apart. What followed was not accountability, it was not public protection, it was the beginning of so far a 3.5 years ordeal with a government agency known as the Healthcare Complaints Commission. Before I share what happened to me, I want to thank Barbara and Michael O'Neill for allowing me to be part of this demonstration. I'm honored to stand and fight alongside both of you. I want to thank Senator John Ruddy. Thank you for your public support in calling out the Healthcare Complaints Commission. Your willingness to speak in Parliament that others were too afraid to confront. And to the members of the public, thank you. Thank you for your support, your presence at my hearing, for your words of encouragement, and to strengthen me and keep me going despite what seems like an endless and unjust battle. I'm deeply grateful. Thank you. I believe I became a target because I prescribed ivermectin.
Holy horse paste!
A drug that was showing promise in treating COVID-19. I wasn't investigated because I harmed anyone. I didn't. I was investigated because I challenged the official narrative. There was a worldwide agenda to discredit this drug. And had it been recognized as a safe and effective, it could have undermined the basis for emergency use authorization for the COVID vaccines. So doctors like me who relied on science and experience had to be silenced. The first complaint came from Westmead Hospital intern. She later admitted she didn't know why she made it. She said she was following instruction of her supervisor, Associate Professor Naran Gunja, the head of toxicology at Westmead Hospital. The patient involved never gave consent for that complaint. In fact, I was led to believe that consent had been given. It had not. The second complaint came from someone calling himself John Smith. There was no working phone number, no valid email address, no physical address. He could never be identified. His complaint was based on a stolen ivermectin prescription, one I had left at the chemist due to a supply shortage. The script belonged to a family member. John Smith forgot to redact the Medicare number, and that allowed me to confirm who it belonged to. A chemist assistant later told me that the script had been handed over to an APRA agent. Despite these baseless and improper complaints, the Medical Council decided on the very same day it notified me of the complaints to convene an emergency suspension hearing under Section 150 of the national law. I was given little to no meaningful opportunity to engage in the process. The speed in which it proceeded gave the impression that the outcome had already been decided.
Shame!
I was denied every form of due process, no proper notice, no fair hearing, no opportunity to defend myself. Every principle of procedural fairness was cast aside. But it didn't stop here. It didn't stop there. After my suspension, the Medical Council had only one lawful role: to refer the matter to the Healthcare Complaints Commission. Instead, they did something else. They took their own internal document, the reasons for suspension, and secretly reclassified it as a third complaint.
Dishonesty.
It was not disclosed to me, not for 6 months. That complaint was never served, never assessed, never identified. And here is the legal problem. Under the law, the Medical Council cannot make a complaint in such situation. Its role is to refer, not to prosecute. But by turning its own adjudication into an accusation, it acts as both judge and accuser, and it violates the rule of law.
Disgusting.
The third complaint was the only one the Healthcare Complaints Commission ultimately relied on. They quietly dropped the other two. But they continued referencing all three in their letters, misleading me and my legal team for more than 18 months, while pretending to investigate all three complaints. They had already decided to prosecute one, the one they had created. And so I was dragged before the tribunal, where the Healthcare Complaints Commission is now trying to cancel my registration for up to 5 years and imposing a fine, all based on a complaint they had no jurisdiction to make, secretly created, and which was never lawfully served. After I was suspended on the 27th of October 2021, the Medical Council and the Healthcare Complaints Commission has had a statutory duty under Section 145D to refer my case to the tribunal if they believe the complaints, if substantiated, may justify suspension or cancellation. That referral is not optional. It is a safeguard. It is a mechanism through which a doctor gets to defend themselves. Then, on the 14th of April 2022, the Court of Appeal, comprising of 3 judges, including the Chief Justice, handed down a decision of
Just keeps timing out. Go. Sorry.
Then, on the 14th of April 2022, the Court of Appeal, comprising of 3 judges, including the Chief Justice, handed down decision in Prison v. Medical Council of New South Wales. Although this case did not set precedent on Section 145D1 of the national law, the court gave clear guidance. Serious complaints must be referred to the tribunal. That judgment confirmed what the law already intended. It was after that decision that I challenged the failure to refer my case, first before the tribunal, then the Court of Appeal. But the courts ignored the reasoning in prison. They denied me the process that Parliament had intended. I maintained that the decision in my case were not only wrong in law, they were fundamentally unjust. The reality is this: the basis for my suspension was invalid. The complaint used to investigate and prosecute me was unlawfully created. And despite following every legal avenue, from tribunal to the Court of Appeal, I was denied justice at every step. The fact that this could happen in Australia, a country I believed in, tells me something deeply is wrong with our legal system.
Yes, exactly.
This is not supposed to be a lawless society. There is supposed to be a rule of law, and that must apply to the regulators just as it is to each one of us. It cannot be allowed to go on. Something must be done. We're not China. We're not North Korea. The Healthcare Complaints Commission is a statutory body. Its power comes from legislation, and it must act within the law. When it operates outside the law, by inventing complaints, seizing records without consent, and prosecuting doctors without jurisdiction, it commits serious legal violations. And if this can happen to me, a doctor with an unblemished record who saved a woman's life, then it can happen to any doctor. And if doctors are afraid to
Bloody ASIO!
Fully battery charged. There you go.
And if this can happen to me, a doctor with an unblemished record who saved a patient's life, then it can happen to any doctor. And if doctors are afraid to speak, then patients suffer. That is why I'm calling for Parliamentary Oversight Committee to investigate the Healthcare Complaints Commission fully. Urgently and publicly. We must demand an inquiry into the creation and concealment of the third complaint, accountability of the misuse of Section 150 powers, investigation to the unlawful seizures of patients' records, a review of all cases where Section 145D was not followed, and enforcement of legal duty to refer serious complaints to the tribunal. Oversight on how the Healthcare Complaints Commission exercises its authority against doctors and health practitioners who cause no harm. Because if the Healthcare Complaints Commission allowed to operate without limits, it can invent complaints, prosecute doctors, strip away rights behind closed doors, then we, the people, will have allowed a government body that had long behaved like a tyrant to become one of the greatest threat in public health in this state. We must restore integrity in our institutions. We must stand by the rule of law, and we must protect the rights of doctors to practice medicine ethically without fear. Thank you.
Huge round of applause to a very courageous lady, Dr.